Welcome to Future Talks. In previous episodes, we discussed about young Cypriots that represent the country through their startups, through their endeavors abroad. And today we have one such Cypriot. We have Antonia from NeuroPin. And basically, she has finished a PhD in computational neuroscience and launched a neuroscience startup in Sophia-Antipolis in France. And now they're growing. They're a team of 4 people. And we are here to discuss all about it today. And basically to tell us about you, your journey, and your thoughts about eventually coming back to Cyprus or scaling part of your startup back to Cyprus. So welcome.
Thanks so much for having me. I'm really excited to be here because I work in France, like you said, but this is my home country. I'm from Cyprus, and I'm always excited to show what people are doing outside of Cyprus and hopefully bring some of that back to Cyprus as well. So I really appreciate the opportunity to be here.
Good to have you with us. So let's start from the beginning. How did you end up in France? How did it all start? And what led to the creation of your startup?
I ended up in France kind of by accident. I'm not French. I don't have any connection with France outside of the PhD. Yeah. I finished my master's at King's College in London, and I was looking for PhD opportunities. I kind of just applied to any project that I was interested in all over the world, and I got the PhD that I wanted in France. So I was like, okay, let's go. I didn't even do French in high school. I had to learn that too. But I loved it. And after doing my PhD in France, I decided to stay there. My PhD was in computational neuroscience, like you said. The idea was to develop novel methods for understanding the anatomy of the brain through imaging. Yeah. I love the topic, I loved my project, but I wanted to have more of an impact in the real world. I felt like I wasn't doing enough to actually impact patients, which is why I got into neuroscience in the first place. And after my PhD, I came back to Cyprus and I was looking for jobs anywhere in the world, anything that interested me. And while I was looking for jobs, I was discussing with people in the clinical field of neuroscience, because that's the field that interested me. I was discussing with radiologists, neurologists, neurosurgeons, and I found that there was a common gap that everyone was complaining about in the field of neuroscience. There was this gap between the cutting-edge neuroscience techniques that I was learning in research and actually what was being applied in the clinical world. And when I narrowed that down, I found that the most pertinent application for that was in radiology. So while I was applying for jobs, I started to look into some market research, and I realized, hey, I could make a scientific project out of this. So I contacted my institute from where I did my PhD, and they said, actually, we have a startup branch, a startup studio branch. You can come and be incubated by us, work on your project, see if it manifests into something. And I thought, okay, this is a great opportunity. And now it's been 2 years. We're linked with the university. We're a team of 4 people. We are currently working on our prototype. It's a software for radiologists.
That's pretty awesome, actually. That's a pretty awesome story. And as a fellow alumni of King's, I did my first degree there as well. Go Reggie. I think it's Reggie the Lions.
Oh, the lion, yeah.
Yeah. Apparently there's a mascot. So it's pretty awesome how it all turned out, how everything quite fell into place, and you spotted a gap. I'm not going to say in the market, but in the science to go after it. So in regards to the prototype, what is the biggest problem you're solving? You told us about the problems the radiologists are facing. I'm a bit unfamiliar with the terms, so if you don't mind explaining it to me and the audience in a bit of layman's terms. Yeah,
that's a really good question, because we do have a main obstacle right now. So radiologists, they're a branch of medicine where they are trying to understand the body through imaging, through MRI, through CT, and we're specializing in the brain because that's my area of expertise. So I talk to radiologists and I ask them, what's your biggest difficulty when you look at images of the brain and you try and write a report about it? And from that report, you make a diagnosis, and then you give treatment or surgery or follow-up. And they came up with many issues, and one of those was the standardization of imaging. So a Siemens MRI machine might be different from a Philips MRI machine or a GE MRI machine, and this affects the image quality. And then that affects the follow-up of the patients. So trying to understand how can you detect problems in the brain and follow that detection over time. there's not enough of a focus on what we call longitudinal radiology, change over time.
Yeah.
And that's absolutely crucial in understanding neurological disorders, because one of the biggest things to understand is what's the problem and how is it different from the last time we saw this problem.
Yeah.
This is somewhere where AI can work really, really well because we have so much data, and this is exactly what AI is for. So humans take a lot of time and a lot of energy and a lot of subjective bias when looking at images of the brain and trying to understand that change over time, especially when the images aren't standardized. So what we're trying to do is create a robustness pipeline to standardize the images, and then make sure that we can apply that to a succession of images.
Yeah.
So get all of that data and then use AI-based algorithms in order to understand how can we track that change over time.
And that makes a lot of sense, because if you standardize the data, you can train the AI model on a particular sequence. So, and you're able to monitor a patient's situation dynamically instead of statically.
That's exactly it. Yeah.
You explained it perfectly, because I have no idea and I understood it. Thank you for that. So, what is it like to develop a prototype, an MVP for a neuroscience-led startup? Because so far, or in most of the times, we usually talk about software startups and what is it like to launch, a prototype in the market, but this is entirely different. You're launching a science-based project as a prototype. So what is that like?
So medtech, medical technology, is known for being really difficult and having a lot of obstacles and having a really long roadmap before you get to market. And it's true. One of the biggest problems that we have is getting the right data. So part of how we sell ourselves is that we are being clinically representative. This is a huge issue in medical imaging, that the data that you train on has to be a really good representation of the people who are actually affected by that disorder. So we are trying to partner with hospitals to make sure that we can train our model on clinical data that has already been taken, so that whatever software we use is based on actual data that already was taken.
If I understand correctly, do you use that data from the hospitals if it was a pre-existing condition, to try to simulate it through your model to see if you would have predicted in the right way?
We're not in prediction yet.
Okay.
Prediction is definitely in the 5-year plan.
Okay.
But to do prediction accurately, you need huge amounts of data, and also retrospective and prospective data. And for the moment, we're only using retrospective data.
Okay, that's what the retrospective data, that's what I was getting at. And that actually brings me to the next question. You said about a 5-year plan. So the next milestone is to create the prototype and go out and test it with the hospitals you've been talking with and the clinics. What comes after that? Once you have the prototype out and it works and it gives you an interval of confidence, that the algorithm is actually accurate, what comes after that?
So first we're doing our prototype, and then we're going to deploy it on an informal basis to doctors in order to give us user feedback. This will help us determine which direction to go in for our minimum viable product, our MVP. The minimum viable product has to be targeted to a specific disease. This is because with our MVP, we have to do clinical trials. We have to make sure that our software works on the disease, that it has efficacy and efficiency. And now, because of the new AI Act in the EU, we also have to make sure that the clinical trials include proof of ethical AI, that our AI-based software is ethical. It's absolutely crucial in order to get approval by the EU. So any medical device in Europe has to pass EU CE mark regulatory approval. And in order to do that, you need to have ethical AI proof, you need to have clinical trials that show that your software is working, and that everything is working and up to speed, that all of the data has been secure and is private, there's no risk of leak. So that's why clinical data is really important too.
Have you decided which disease you're focusing on, or is that still pending?
That's one of our biggest obstacles right now.
Okay.
So from the description that I said about the software, following disease over time, as you can imagine, you can apply that to many different kinds of diseases. So that's what we're doing.
But they have to deteriorate the brain over time. Like Alzheimer's, for example.
Alzheimer's, for example, Parkinson's, multiple sclerosis, epilepsy, depression, neurodevelopmental disorders. There's so many things that are time dependent.
Yeah.
And we look at that as an advantage at the moment. So our prototype is generic in that sense. But after our prototype, we're going to get user feedback and see how it works with various diseases based on the data that we can get, and then target towards that disease for our MVP.
Okay, that's pretty cool actually. And circling a bit back, you mentioned at the beginning how you called your university and they mentioned they had a startup studio program and they welcomed you to that. Let's talk about the ecosystem of Sophia-Antipolis, which is a technology ecosystem, one of the most vibrant ones in Europe. It's been around for a few decades actually, and a lot of things have been happening there. So I would like you to share with us, how is it like starting a startup there?
I love Sophia-Antipolis. I know the area because that's where I started my PhD. I finished it in Paris. Yeah. So I'm familiar with both ecosystems, and both ecosystems are really vibrant. There's a lot going on in Paris, but everybody knows about Paris.
Yeah, Station F and,
exactly.
And all of that.
Yeah. So there's a lot going on in Paris, and rightly so, but in Sophia-Antipolis there's also a huge push for entrepreneurship because there's a huge research-based ecosystem as well. And in France, especially in the last few years, there's huge encouragement for research-based entrepreneurship. So the ecosystem there is linked with the university, it's Université Côte d'Azur. There's the INRIA, the National Research Institute for Digital and Informatic Research. That's where I am. Links with Paris, links all over France. And basically, it's a really great ecosystem, not just in terms of research and entrepreneurship, but the people there are really friendly and open, and we all help each other. Yeah. So it's a really nice place to be, nice place to start.
Yeah, I mean, the culture is the most crucial thing in an ecosystem, you know, sharing knowledge, cooperating, and all of that. And you mentioned that basically your startup is a spin-out from a university. And
not exactly.
Not exactly, okay.
It's... as I mentioned, I wanted to be more clinical applications-based rather than research-based. My PhD was more methods-based.
Okay.
So it was developed independently, but I went back to my university.
Did the university claim any percentage on the startup? And the reason I'm asking is to compare it to here at Cyprus. I think the universities are claiming somewhere between 20 to 25%, and you can correct me if I'm wrong. What was the rate there?
The INRIA Startup Studio, the branch of the National Research Institute there, they house you for 1 year. They take 5% of your company at the moment of creation, of moment of selling, and they own all IP until you leave INRIA. So when you're housed by INRIA, they own your IP. They keep it secure. Everything is secure and safe. And then once you leave, they own whatever IP you developed under them, and then it's yours.
These are actually pretty attractive terms, you know, to encourage research to go into the industry.
Definitely.
So what would a bright young individual like yourself consider to come back to Cyprus one day, or create a spin-out of their startup to Cyprus one day? What would attract you to come back home in some shape or form?
I think it's crucial for Cyprus to start developing stronger links with the rest of Europe in terms of entrepreneurship. It's something that I would like to be a part of. So I want to grow my project until it's big enough to have strong links with Cyprus. I would like to use whatever we're developing in Cyprus and strengthen those links between them. And obviously Cyprus is my home country. I can imagine coming back here one day, and it's a project that has a global impact, a European impact, a national impact, and I want to make sure that whatever impact I have on the world has an impact in my home country. So what I want to see is more openness to research-based entrepreneurship, more openness to applications of research in the real world, and more openness to links with other countries in the EU.
That's pretty awesome, actually, and I'm sure that the Chief Scientist and the Director General of the Research and Innovation Foundation are listening to us. They've always been supportive, so maybe you should get in touch with Antonia and communicate about that vision, because we want to attract talent back into the country. And my last question would be, If you would give advice to aspiring entrepreneurs or students, in the research fields who may be doing their masters or PhDs, and then they're considering whether they should go into academia or they should go into research, or they should take the leap and start something on their own based on what they have discovered, or something, some research-based aspiration, what would that advice be? Because you're someone who actually took the step.
It's really difficult to give advice to somebody else because all I did was just take opportunities as they came. It's really difficult to plan our lives anymore because you have to be adaptable. So just, if any opportunity comes that you like, take an opportunity and see where it goes. I think that's all we can do.
And that's actually the best advice for startups as well in general.
Startups,
to be agile, to solve problems than plan everything ahead.
Yeah, definitely. Agility.
Thank you for being with us today.
Thank you so much.
It was a very inspiring story, and I'm sure we're going to hear more information and more updates about the startups very soon, because your prototype is due and everything looks so promising. And as aforementioned, it would be good to attract talent like Antonia's back home. So if there's someone out there in the ecosystem, in the biotech space, in the neuroscience space, and I know there's a few of you that have collaborative opportunities, and the Research and Innovation Foundation as well, do reach out, because that's what we're trying to promote through Future Talks. Thank you for being with us.
Thank you so much.
Thank you, and thank you for watching. See you in the next episode.